This is Dr. Corey Maas on Looking Your Best, talking a little bit about lips. I've done a bunch of lips this week, and I've had so many great questions from patients. I thought I'd answer them for you, share them, and I encourage you to ask more questions if you have them. It's important to understand that there are different morphologies that really make up, or appearances or shapes that make up an attractive lip. Actresses like Michelle Pfeiffer, Janine Triplehorn, even to some extent Angelina Jolie, have a very strong lateral body to their lip and not so much central Cupid's bow, whereas other very attractive lips have a very strongly defined lip border and Cupid's bow. A good example of that would be Marilyn Monroe, for example. Everybody knows that image. So it's not one lip type or one lip style that makes the lip attractive. It is really the relative proportions of the lip, fullness, which is a sign of youth, and then the proportions being that the lower lip is always slightly larger than the upper lip, and typically those ratios can vary, that the upper lip occupies a quarter to a half of the entire lip itself. This is the white lip, this is the vermilion. We want to make sure that the red part of the lip occupies at least a quarter to be attractive. When it starts getting thinner and thinner, of course, the lip becomes less significant or less attractive as a feature. And if you look at baby pictures, you'll see that the baby's lip really occupies more. The vermilion portion, or the red part of the lip, occupies more than half. In the Cupid's bow area, when we're talking about elevating it, there's no specific way to make the Cupid's bow in isolation come up with fillers alone, but we can certainly enhance that portion of the lip right along the vermilion to make sure that the parts that make up the Cupid's bow, the two philtral ridges, and if that's done, it's called the Paris lip from the 1980s when it was first described. And if we do the entire bow portion of the lip along with that, we really get very nice enhancement and eversion of the lip. Again, that doesn't make necessarily the lip attractive. If you have a nicely defined Cupid's bow, you want to enhance it further, that makes your lip attractive. If you have a greater lateral body to the lip, like the aforementioned actresses, it's better to do a little bit of vermilion border enhancement and then just maintain, just like Jolie and many of the other actresses do, maintain their lips with lateral fullness. We want to make sure that lateral fullness, or the body of the lip, stays there. There are surgical options, which I've described before, which I think are very important. The lip lift is a very, very valuable procedure. I do not like direct lip advancement unless it's cases of this cancer revision or other things, where an incision is made right along the lip border, because the white roll, the natural roll that comes off the lip, the little ski slope, is lost when we do that in most cases. And so when I do advancement of the lip, it is with an incision that's very carefully hidden inside the nostril and right along the border of the nostril rim and what's called the columella, the little skin between the two nostrils. So in the nostril, along the nostril vestibule, the nose vestibule, the inside of the nose. And by doing that, I can take out a portion of the white lip and literally lift the lip up in its central portion. That is a nice way of doing it surgically. There are certainly nice ways of enhancing the Cupid's bow, but no way of truly lifting it like we can do surgically. So those are really good. They're technical questions. They are very artistic in their execution, and you certainly want to go to someone that has a great deal of experience in specifically lip beauty and enhancement to get the very best results with that. If you have any other questions about lip enhancement or augmentation, it's a special favorite of mine, please don't hesitate to send me photographs or videos of your lip. It's nice to see them animated, but I can also see them in several different shots with them pursed, with the smiling, and then in repose when they're relaxed, and talk a little bit about what the best options for you might be. As always, this is Dr. Corey Maas on Looking Your Best.